So how are you doing today?
I'm alright, pretty good.
All right. So have you been to a therapist before?
A while ago, probably when I was like 21, 20,
How old are you now?
27.
So it's been 6 or so years.
Mm-hmm.
Okay. Well, just in case you forgot, you can tell me anything and it doesn't leave this room unless you tell me that you're going to harm yourself or others. Then I am a mandated reporter, so I do need to make sure that you're okay and you're not going to act on any impulses like harming yourself. If you tell me that you're contemplating suicide, those are things that I do need to report, but anything else stays here. So, is there a specific reason that you decided to try therapy again?
I don't know if there's an exact reason. I think maybe I just need like a better outlet to vent other than like if friends or family, like it's almost like an outside opinion
Okay.
type deal. But yeah.
So, do you think you have supportive family and friends?
I think I do. I think it's very kind of like black and white. Like if it were to be my family members, you know, they have their own set of opinions and what they think they or they, what they think that I want or should or deserve or whatever. And then my friends are just like, I don't even think they actually give good advice, to be honest. So that's only like an outlet that I can use for certain topics, I guess.
Mm-hmm.
So that's it.
So, is there anybody specifically that? So you're saying your family and your friends. Like, is there anybody specific in your family that you can talk to, or anybody specific in your friends?
I think if it were a family member, the only person that I'm more comfortable talking to, like off the bat, for something that I am seeking or just need to talk, it would be my mom.
Mm-hmm.
If it's like my friends, I don't know. I could probably maybe choose one of them. His name's Nick. But it would have to be like a certain scenario.
Okay. So do you genuinely just bottle things up, or do you use those outlets to vent?
I think in the past I would bottle things up
Okay.
because it's easier.
Mm-hmm.
Yeah, and then I would end up exploding on somebody, and it kind of sucks because normally it would be like it's either like a family member that I'll take it out. It's like displacement, I guess that's what it's called. So I would take it out on a family member, or just like some random person could just set me off, kind of deal. But
Well,
now,
it sounds like you're pretty self-aware if you're recognizing that. But I'm sorry to cut you off.
no, I mean now I think I've gotten to the point where I can identify like when it gets bad or when it's gonna get bad, and but you know, there's always like those times where it's just like it's like flipping a switch, you know.
Do you have any examples of that?
I think at work I am pretty mellow until like, you know, either it's something like my boss, some expectations from my boss, and you know, if the day's not going well and it ends up a couple days in a row, and then like at the end of the week like something really doesn't go well, then I'll just like completely, I can't really. I don't know. I just kind of like explode, and I won't take it out on an employee, but I will take it out, verbally. I don't know what else to say. To be honest.
So do you think that, so you're saying that it's usually something triggering you at work? Is it that day something triggers you, or it's kind of the build-up, or both?
I think it's just the build-up. I think a lot of people are soft-willed, generally. It's not like more or less physical. It's just like it's a mindset, and like my job, it's a stressful area, but then like I have all these people that just don't get it, and it's just like working in the blue collar industry for almost my entire adult life. It's like real, these past couple of years, it's like a real flip. I don't know what it is, or what it, like people feel entitled or something, but just like as soon as I run into somebody that starts to like complain too much, it's automatic, like
It's a trigger for you?
Yeah.
And what do you do?
Well, I'm trained through my job to deal with it a certain way. Okay, but internally I don't deal with it the way I'm supposed to, probably.
What does that mean to you, the way that you're supposed to?
So I'm supposed to like see it from like their point of view, and like try and understand why they're struggling, or why they're doing what they're doing, and then come up with a solution. But it's almost like I don't want to cater to people's needs just because they're human a little bit. Like I don't know how else to say it, because
I understand.
it's not even like, it's not just a male, and so it's not just a male dominated industry that I'm in. There's a lot of females, and what sets me off even more is when the females are working harder than a guy, and it's just like I don't get it. It's like age is not a thing. I have older men and women that will work their asses off, and then I'll get like someone middle-aged or a young kid, and it's just like I don't understand like the work ethic that comes along with certain people. It's nuts.
So you are the boss of people working under you who aren't working up to your expectations?
Yeah, so I guess I didn't explain that. I'm an operations manager for a company, and generally I have around 15 people that work directly underneath me. For like it's only a part-time gig for them, so it's only like for like 3.5 hours, 4 hours, sometimes 5, like it varies. But yeah, but I'm there like 6, 7, sometimes 7 days a week, depending. And yeah, so I just monitor them working pretty much the whole time, but I will jump in and help them out if I have to when it comes to the physical part. But that's it.
Okay, so I'm sorry, just give me a second. I'm not ignoring you. So it sounds like you have a lot of work stress. Is that, you think, your biggest problem right now that you're trying to cope with?
Yeah.
You're set on that?
Yeah.
Seems like you're questioning it a little bit.
Yeah, I mean, I'm sure that's part of it. It's just one angle that you can look down. Yeah, I don't know.
Okay. Well, that's a start. And that's it for today, really. Our time's up, but if you think, do you think that talking about your work problems helped you feel a little bit better today?
Sure. Yeah, I think so.
Okay. Well, if you want to come back to see me, then I'd be happy to see you again, but if not, then if you still think you want to see a therapist, but just not me, then you can give me a call or email me and just let me know, and then I can point you into the direction of somebody else, because I don't want you to completely stop therapy if you decide you don't want to come back. Does that sound okay?
Yes.
Okay. Alright, we're done.